Hello everyone, my name is Dr. Hussain Muneer. Currently, I'm working in Hangzhou Hospital, Yizhou, China. I'm part of California Institute of Research and Technology, and I would like to thank Dr. Bal who gave me this opportunity to participate in this symposium. And today I want to talk about one case report let's talk about. The title of this case report is "The catheter was shedding into the right atrium after dislodging from the intravenous infusion port and caused premature atrial contraction." Firstly, I want to talk about the introduction. What is this central venous catheter? We all know about it. In the hospital, almost all the department, we use these devices. So we utilize these devices for various procedures such as intravenous infusion port, blood sampling, hemodynamic monitoring, and chemotherapeutic agent, and intravenous IV antibiotics. These are frequently employed to provide long-term intermittent access to the central venous system. Nevertheless, these catheters come with certain risks, and approximately 10 to 15% of patients using them may encounter complications related to the catheter. Uncommon complications linked to central venous catheter, including central catheter fracture and subsequent embolization and thrombosis, which possibly injury to the cardiac structures. The most common location of the fracture fragment varies from right heart chamber, is the one of the most predominant site of the embolization. So here we have one case, like 72 years old male patient who will present with embolized catheter migrated into the right heart. And we also discuss about its management. Firstly, I want to talk about the case report, like the history of the patient. This is 72 years old male patient with a history of gastric cancer, was admitted to our hospital 3 years ago. At that time, he underwent distal gastrectomy. After that, he received 6 rounds of chemotherapy. And for this chemotherapy, we introduced permanent central venous catheter. 1 month ago, this patient came visit hospital for follow-up and routine examination. So we firstly performed the ECG, and we find a unique findings there, like ECG with bradycardia and premature atrial contraction. And I show this in figure 1 on my poster. And after that, we also perform the transthoracic echocardiography, and we also find these catheters like making the loop in the right atrium, and the tip of this catheter was present in the right ventricle. To make the more evidence to our this case, we perform chest X-rays. Chest X-rays shows a fine, dense tubular shadow extending from the right atrium into the right ventricle at the level of 7 to 9 thoracic vertebra. And this is the dislodged port catheter, which we insert in the right subclavian vein. This port catheter was broken from the infusion port side and dislodged into the right heart. Let's talk about firstly how we retrieve this catheter from the heart. So we refer this patient to the international cardiologist, and he is the one of our team member in hospital, and he performed this surgery. So firstly, he performed the fluoroscopy and make the proper position of this catheter, like how it's located inside the heart. Firstly, he do the right internal jugular vein access, and then he introduced the guide wire, and then he used 5F pigtail catheter was passed over the guide wire and introduced into the right atrium through the right internal jugular vein sheath. With the help of the guide wire, the pigtail catheter crossed over this loop, which this dislodged catheter made into the right atrium. And then this pigtail catheter pulled out this catheter into the superior vena cava. One end of this dislodged catheter was free into the superior vena cava, and then the second part of this procedure, they perform second catheterization from the right femoral venous access, and he used 6 FR sheet, and then he made the simple loop scenario was introduced into the right femoral vein sheet and grab one end of this central venous catheter and pull into the inferior vena cava. After that, the whole assembly of this scenario guide wire and this sheet catheter was successfully withdrawn from the body. This whole process to retrieve from the body is called scenario loop technique. We mostly use take this technique to remove the foreign body from the heart. So let's talk about some discussion part and also the concluding part. The most identifiable cause of the fracture or dissection of the port catheter is pinch-off syndrome, a mechanical complication of the port catheter placement. This syndrome is characterized by chronic intermittent compression of the catheter between the clavicle and the first rib, a condition that arises when the catheter has been inserted too far medially, leading to catheter erosion and fracture. In this syndrome, what happens if we introduce this catheter near to the sternum between the first rib and the clavicle? What happens when the patient is the posture position changing and they put more pressure on this catheter where we insert the insert point, and that leads to fracture of this catheter. So after that, this is the one of the most common cause of this catheter, and also other also cause like when we push like a fast bolus, we push into this catheter like a series catheter. This also cause the dislodge from the infusion port and dislodge and go to into the other organ. And the most common organ is cardiac. And conclusion part, how we can prevent this problem. First of all, proper positioning and ongoing monitoring of the catheter are essential to prevent the complication. So fracture and dislodgement can occur due to mechanical stress or improper placement, leading to migration, obstruction, and other serious issues. Clinician knowledge and awareness about this complication when diagnosis are crucial. This will alert them to seek immediate medical intervention, which can significantly reduce the mortality risk. This is all about our case report, and I would like to thank Dr. Bani, who is my mentor, and who gave me chance so I can represent my case here. So thank you guys. See you again.